everyone. Welcome to the latest webinar from PDC Mums and Bumps. This one is all about postpartum with type 1 diabetes. My name is Caitlin Parker. I'm an accredited practicing dietitian, a credentialed diabetes educator, and I live with type 1 diabetes. Just a disclaimer to get started. A reminder that the information presented is general in nature. So everybody, every pregnancy, every experience is different. So use it as a general guide of what to expect. As with all things related to diabetes, you could be the exception to the norm, and it's important to consult with your healthcare team about your individual circumstances. So starting out with, what do we mean when we say postpartum? So it's often referred to as the fourth trimester, and it begins immediately after birth, generally lasting for about 6 to 8 weeks, but could be longer. The body goes through substantial changes while gradually returning to its pre-pregnancy state. In this postpartum period, we need to adjust to things like breastfeeding, sleep disruption, and these new caregiving responsibilities that we've been given. We also go through a huge amount of emotional and psychological changes. When we go home after birth, each hospital has their own policy on timing. Generally, you stay a little bit longer after cesarean birth, but some hospitals may have a bit of a transition program where you go home a bit earlier and someone like a midwife will come to check on you at home. Usually, to see if the mum is ready, they do a health check. They make sure that you're eating, drinking, and passing urine. They make sure your pain is managed and that you can move and walk. They want you to understand any ongoing healthcare needs and make sure that you're aware of your baby's needs, and also that you have all of the referrals that you need for follow-up care. To determine if your baby is ready, they will also do a health check. They want the baby to have a feeding plan in place. They'll discuss vaccinations. They will provide you with the birth registration paperwork and the purple book. They'll give this to you and explain all of the information in there. And the baby will also receive referrals for any follow-up care that's required. Other things that they consider are making sure that you have the medication that you need and that you take it home with you. Make sure that you have transport and your car seat is correctly installed. And they make sure that any discharge paperwork is completed. Immediately after delivery, we have what we call this insulin cliff. During pregnancy, your placenta produces a whole lot of hormones that cause significant insulin resistance. And as soon as that placenta is delivered, those hormones vanish within hours. So you had this this insulin resistance that made you require a lot more insulin than previously, and then suddenly those hormones that cause that insulin resistance are gone. Because of this, we have a massive drop in our insulin requirements. So we become much more sensitive to insulin, and this increases our risk of severe hypos. Because of this change in our hormones, we need regular adjustments of our insulin doses for the days and weeks following birth, especially if you choose to breastfeed. We want to make sure that we're keeping an eye on our blood sugar levels, and we want to seek support from our diabetes team to make adjustments if we need it. The ADIPS guidelines, which are the Australian Diabetes and Pregnancy Society guidelines, they recommend reducing insulin to approximately half of the pre-pregnancy dose immediately after delivery, and then adjust doses based on what your blood glucose levels are doing. Your diabetes team will help you to prepare for these insulin settings during your antenatal appointments, and you can talk to them about having a more concrete plan in place for you with specific doses. In this postpartum period, we also have a shift in our blood glucose targets. During pregnancy, we had that really strict target range of 3.5 to 7.8. We were focusing on avoiding high blood sugars, and we had a target HbA1c of less than 6.5 or less than 6 if it was safe to achieve these targets. Postpartum, our mindset changes. Our new target is between 5 to 10, and what we really want to focus on is avoiding lows. An HbA1c rise along with this change in target numbers is expected and it's really normal. So don't stress or feel worried if your HbA1c increases. We spoke about our risk of severe hypos increasing in the postpartum period. And it happens because we have this sudden insulin sensitivity rebound. So we're using much less insulin even before we got pregnant. We've got extra things like sleep deprivation, changing priorities, and both of these things might change our hypo awareness or how we're feeling. If you choose to breastfeed, you've also got breastfeeding using up more glucose as well. Your meals and snacks might not be as regular as they were before, whether this is because you're doing things for your baby, trying to fit everything in, or squeezing in a nap. This can really change our meal structures. We're also really tired. So the diabetes decisions that we may have made when we're feeling well rested can be quite different. And sometimes we can end up with too many correction boluses, which increase our risk of going low. As we said before, our main priority for diabetes management in this period is to try and stop those lows. And it's because we want to make sure that we keep you and your baby safe during this time. Some of the strategies that you might use to help reduce the risk of going too low are setting our CGM low alerts higher than usual. So we might set it at something like 4.5. We want to keep hypo treatments in multiple accessible locations. So you might keep something beside your bed, you might keep something next to the change table, in your nappy bag, next to your regular feeding spot, anywhere where you can kind of grab what you need when you need it, because you will often be holding a baby or doing something for your baby when your blood sugar level alert goes off. We want to avoid stacking corrections, especially overnight. Again, the priority is reducing risk of lows. So if you're a little bit higher than you'd like to be, generally it's okay to let that sit for a little bit. Teach your partner or your support person about emergency hypo treatments, including things like glucagon, and keep a good eye on your blood glucose levels, especially before sleep. We spoke before about how breastfeeding can increase risk of lows. So most women with diabetes are able to breastfeed their babies, but there are a couple of extra things that we need to take into account or be aware of. So blood glucose levels can fall by 3 to 5 millimoles during a feed. So a lot of people find that management strategies that they use for exercise work effectively for feeds as well. So reducing insulin generally is a good strategy. Breastfeeding can improve our insulin sensitivity further. Lactation requires glucose, which is a type of sugar, to produce lactose, which is another type of sugar. The lactose is the carbohydrate that we find in breast milk. Each feed draws glucose from your bloodstream, and this increases the daily energy requirements or the amount of energy that you burn. It's helpful to keep water, hypo treatments, and snacks close to your regular feeding spots. So we want to make sure that we're staying hydrated as well. With our CGM subsidy, so the NDSS CGM subsidy automatically continues for 3 months after your expected due date, even if you give birth before that. The pregnancy and postpartum CGM subsidy means that you get free CGM for those 3 months after your expected due date. So we've had the immediate postpartum period. We've got the checks before you go home from hospital, and then we have another check at around 6 weeks. So this could be done by your obstetrician, or it could also be done by your GP. If it's done by your GP, they will generally receive a summary of your hospital stay and the birth details. So they will usually discuss things like any pregnancy complications that you may have had, your labor and mode of delivery, any issues you're experiencing. So this could be issues with your bladder or your bowel, breastfeeding problems, pain, sleep. They may talk to you about your mental health. Make sure you and your baby are up to date with any immunizations. They will usually discuss any contraception planning with you and a plan for resuming your pre-pregnancy medications. Usually in the physical examination, they will check things like your vital signs, including your blood pressure. They'll check your temperature, they'll check your breast health, and they'll do an abdominal examination, particularly if you've had a C-section, they'll check the wound, they'll ask you about any tenderness, they'll check the muscles in your abdominal. If you're due for your cervical screening, they will do this then as well, and a perineal assessment if it's necessary. They may also refer you for tests depending on your symptoms. So they might do things like a full blood picture. They'll check your iron levels, your thyroid. If you've got a wound and there are signs of infection, they may do a swab, and they may do something like an ultrasound if there are signs of a retained placenta. A couple of tips for the 6-week checkup. So it's a good idea to book separate checkups for you and your baby. Let the reception team know it's for a 6-week checkup so they can book a long appointment for you. And take a support person with you so that you don't feel rushed if your baby is unsettled. Make sure you ask for any scripts that you may need. So this could be any pre-pregnancy medications, but it could also be things like your insulin or your glucagon, and discuss how or when to recommence any medications that you were taking prior to pregnancy. You can also ask to be linked back in with your diabetes team if you haven't already done this. One of the extra things that we need to be aware of as a mother with type 1 diabetes is postpartum thyroiditis. So this is where we may develop hypothyroidism or low thyroid levels, or thyroid toxicosis, also known as hyperthyroidism, or swinging between both of these states in the year after delivery, even if there was no clinical evidence of thyroid disease prior to becoming pregnant. These changes in thyroid hormones or your thyroid function are more common in women with pre-existing autoimmune diseases like type 1 diabetes, and it's important to monitor these thyroid levels beyond this 6-week check because the symptoms can develop well after that. See your doctor if you experience any symptoms like constipation, dry skin, fatigue, impaired concentration, cold or heat intolerance, irritability, or palpitations. We also want to make sure that we have a medication review. So often we want a plan in place to recommence any pre-pregnancy medications, and your doctor will help you to come up with this plan. There are some medications that are not safe in pregnancy but are safe during breastfeeding, and there are some medications that to continue or they advise not continuing while breastfeeding. We also want to make sure that we have a plan for contraception. So, as we know, preconception care, if you have diabetes, is very important um, because we want to make sure that our diabetes is well controlled before we fall pregnant. Because of this, contraception can be really helpful to make sure that we are in the best position health-wise that we can be prior to falling pregnant. Shifting now to talk about mental health. So the mental load of diabetes after having a baby can be really challenging. Not only do we have all of the normal changes of adjusting to life with a baby or an additional baby, but we also have to keep managing diabetes on top of all of this. So research shows that women with pre-existing diabetes are more likely to experience postnatal depression, and nearly 2 in 3 women with diabetes experience moderate to high diabetes distress after birth. This diabetes distress can negatively impact our blood glucose management. So, postnatal depression and diabetes distress are not the same things. They can exist separately or together, and screening for one doesn't always identify the other. Postnatal depression may look like losing enjoyment in your usual activities, low confidence or self-esteem, panic attacks or anxiety, loss of appetite, feelings of hopelessness, and ongoing fears about your baby's well-being. If these feelings persist for more than a week or two and they affect your daily life, please speak to your healthcare team about accessing some support. Diabetes distress is different to postnatal depression. It occurs when the demands of diabetes start to affect our emotional well-being. It can feel like being overwhelmed by diabetes, being frustrated with your blood glucose levels, feeling guilty when things don't go to plan, and constantly worrying about your diabetes management. When this distress becomes overwhelming, it can lead to diabetes burnout, where managing diabetes just feels too hard to cope with. The postpartum period can trigger diabetes distress and burnout, especially considering the intense demands of diabetes management during pregnancy. The support is there if you're struggling. So, mental health challenges are really common in people living with diabetes, especially during this postpartum period. The things that can help include managing your expectations. We talked about adjusting that target blood glucose range, as well as um, kind of being kind to yourself with what is realistic to achieve during this period. Taking small steps, so one thing at a time, accepting your feelings, asking for support, and connecting with others who understand. So this is where the PDC Mums and Bumps Type 1 Diabetes Mothers group is really helpful. Don't forget to check in on your mental health at your 6-week postnatal appointment. So your GP, midwife, or child health nurse can help you connect with support if you need it. It's also really important to remember that it's okay for diabetes to take a back seat. So you've just been through the most intense period of diabetes management of your life, and now you're adjusting to life with a newborn, recovering from birth. You may be learning how to breastfeed and dealing with this lack of sleep and exhaustion. It's okay to shift your diabetes management goalposts during this postpartum period. Persistent high blood sugars can impact your healing and risk of infection. So it should be avoided where possible. But remember that shift in thinking where the main priority during this period is just minimizing the risk of hypos. Moving out of this immediate postpartum period, we then want to start thinking about returning to our usual cycle of diabetes care. So check to see if you need an updated GP chronic disease management plan. And it's likely that you probably do after 9 months of pregnancy. We want to check the recency of your complication screenings. So these are things like your nerve function, your eyes, and your kidneys, and link back in with your diabetes educator as soon as you are ready. Thinking of some red flags. So when to seek medical attention. So check in with your GP or your emergency department if you have any fever, shivering, or extreme sweating. You have stinging or burning when you pass urine. You've had a cesarean birth and you notice pus, blood, fluid, or increased redness, swelling, and tenderness in or around your wound. You notice vaginal loss that is bright in color and smells offensive. You experience a hard, red, and painful lump in a breast. You notice that your tiredness is not improving or it's getting worse. And if you're worried, so it's important to also trust your instincts if something doesn't feel right. It's also very important to seek help immediately if you're experiencing extreme emotional distress. So accessing your support network and resources. So Breakthrough Type 1 Diabetes has a really great resource on navigating pregnancy with type 1 diabetes. It's available at this website, and you just fill in your details and they'll send you a digital copy of the booklet. We've also got the PDC Mums and Bumps. So we've got a Facebook group with lots of information on there, as well as connection to other people with diabetes who are pregnant or have had children. We've got the Mums and Bumps Mothers group. NDSS has some great resources as well as Diabetes Australia. So just remember, keep in mind that postpartum is a time of complete upheaval for both you, your body, and your mind. It's okay and very normal to need support and to lean on your support networks during this time. Thank you so much for tuning in and all the best with your postpartum experience. We've got references listed at the end here.